Imagine this: you're enjoying a meal, or maybe just walking outside, and suddenly, your throat tightens, your chest feels heavy, and breathing becomes a struggle. Your heart pounds faster, and panic sets in. For many, this nightmare isn't hypothetical, it's anaphylaxis. But what's even scarier? When it turns into anaphylactic shock, a deadly complication that can happen in minutes. It's crucial to understand what's happening in your body when you face this kind of danger, because it can save your life, or the life of someone you love. Chapter 1: The body's alarming overreaction. Your immune system is like a well-trained bodyguard. Most days, it fights off dangerous invaders like viruses and bacteria. But sometimes, it gets confused and attacks harmless substances. That's what happens during an allergic reaction. Something as simple as peanuts, shellfish, or even a bee sting can trigger a chaotic response inside your body. When your immune system goes into overdrive, it releases chemicals like histamine, which causes swelling, itching, or sneezing, things we're all familiar with. But what happens when that reaction spirals out of control? That's anaphylaxis. It's like your bodyguard pulling out all the stops, mistakenly thinking you're under attack from something much worse. Chapter 2: The red flags of anaphylaxis. In most cases, symptoms of anaphylaxis appear within minutes of exposure to an allergen, though they can sometimes take hours. It starts with symptoms that seem like a regular allergic reaction: itching, a rash, or maybe a stuffy nose. But then, things take a sharp turn. You start to notice trouble breathing or wheezing, a choking feeling, or swelling in the mouth and throat, swollen lips or tongue, dizziness, confusion, or fainting due to low blood pressure, a racing, weak pulse. These aren't just minor irritations, they're your body's SOS signals. Ignoring them or thinking they'll pass could be a fatal mistake. Chapter 3: What's the difference? Anaphylaxis versus anaphylactic shock. Now, you might wonder, what's the difference between anaphylaxis and anaphylactic shock? It's simple, but it's a game changer. Anaphylaxis is the severe allergic reaction itself. Anaphylactic shock, on the other hand, is when that reaction causes your body to go into shock, meaning your blood pressure drops dangerously low, oxygen isn't getting to your organs, and you could lose consciousness. It's like your body's life support systems are failing, one by one. If you're in anaphylactic shock, you're not just facing an allergic reaction, you're facing a full body shutdown. And without quick treatment, that shutdown can be irreversible. Chapter 4: The early warning signs you can't ignore. Early signs of anaphylactic shock can sneak up on you. It might start with something as simple as hives or itching. But then, symptoms escalate, and suddenly you're facing life-threatening complications. Here's what you need to be on the lookout for. Skin turning blue or pale, a grating cough, wheezing or a high-pitched sound when you breathe, swelling of the lips, tongue, or face, struggling to take full breaths. These symptoms are flashing red lights telling you that it's time to act, immediately. Delaying action in these moments can cost precious time, and time is everything when your body is in crisis. Chapter 5: The life-saving power of an EpiPen. When anaphylaxis strikes, there's no time to second-guess your next move. The first line of defense is an epinephrine injection, better known by the brand name EpiPen. Epinephrine is like a reset button for your body, stopping the allergic reaction in its tracks and preventing anaphylactic shock from setting in. An EpiPen isn't just a tool, it's your lifeline. It works by narrowing blood vessels to raise blood pressure, relaxing the muscles in your airways so you can breathe again, and reversing other dangerous effects of the reaction. It's critical to inject it into the thigh at the first sign of a serious allergic reaction. But remember, while the EpiPen buys you time, it's not the end of the story. You must still seek emergency medical help immediately. Call 911 or go to the ER. Chapter 6: The risks of delayed treatment. Imagine your body as a car. An EpiPen is like slamming on the brakes when you're speeding toward a cliff, but you still need to pull over safely. Delaying treatment is like ignoring the brake lights. Even after using an EpiPen, there's a risk of a secondary reaction called a biphasic reaction. This reaction can occur 12 to 72 hours after the initial symptoms, often without warning. That's why observation in a hospital is crucial. In severe cases, doctors may need to administer additional treatments, including oxygen therapy to ensure your organs are getting enough air, beta agonists to reduce swelling in the airways, antihistamines to slow the allergic reaction, IV fluids to stabilize blood pressure, corticosteroids to reduce inflammation. Skipping this step could leave you vulnerable to a second wave of danger. Chapter 7: Why some allergies are more dangerous than others. Not all allergies are created equal. Some allergens, like peanuts, shellfish, or bee stings, are notorious for triggering severe reactions. But the truth is, any allergen can cause anaphylaxis if your body decides to overreact. That's why it's essential to know your triggers. Allergy testing, under the supervision of a doctor, can identify substances that may put you at risk for severe reactions. And for those with unavoidable triggers, like insect stings, there's hope. Allergy shots, immunotherapy, can desensitize your body over time, reducing the chances of anaphylaxis. It's like training your immune system to stay calm under pressure. Chapter 8: Preparing for the unpredictable. It's impossible to predict when or where you might encounter an allergen. That's why being prepared is your best defense. If you've experienced an anaphylactic reaction before, it's critical to carry an EpiPen with you at all times. You never know when you might need it. But don't stop there. Develop an allergy action plan with your doctor. Talk about what steps to take in an emergency, who should be notified, and how to get help fast. And if you haven't had an allergy test yet, make it a priority. Your health is worth more than the risk of being unprepared. Chapter 9: The stakes are high, but you can stay safe. Anaphylaxis and anaphylactic shock aren't just medical terms, they're life-threatening realities. Without quick action, they can lead to fatal respiratory issues, or brain damage from lack of oxygen. But with the right knowledge, tools, and preparedness, you can reduce the risks and even prevent future reactions. If you or a loved one experience a severe allergic reaction, don't wait to see if it'll just go away. Inject epinephrine and get to an emergency room. Treat it like the life and death situation it truly is. Conclusion: take control of your allergy risk. In a world where allergens can hide in plain sight, on your dinner plate, in your yard, or even at the doctor's office, it's up to you to stay prepared. Carry your EpiPen, know your allergy triggers, and be ready to act fast. Because when it comes to anaphylaxis and anaphylactic shock, the best way to beat the odds is to be prepared before the emergency strikes.